Welcome to the Greater Winter Haven Chamber of Commerce Ask the Doctor series. This new series for 2021 is launching in partnership with Baycare and Winter Haven Hospital to give the community an opportunity to get to know the physicians in the community, as well as the very important services that Winter Haven Hospital provides in order to keep the community healthy. So on this very first episode, we are honored to welcome to the show Dr. C.R. Hall. Dr. Hall is board certified in general surgery and specializes in bariatrics. So welcome to the show, Dr. Hall.
Thank you very much. I'm glad to be here in the first episodes.
Absolutely. So where are you from? Let's learn a little bit about you personally first. Let's ask the easy stuff first. So where are you from originally?
Well, originally I was born in Plant City, and I spent the early part of my life there. And then after that moved to Polk County and grew up partially in Lakeland, grew up in some in Lake Wales, kind of moved around that Central Florida area. So I'm very familiar with this area. My mom and a lot of my family currently lives in Winter Haven. So spend a lot of time here.
So you really are a hometown boy coming back to...
Right. Yep, absolutely.
That's great. We love it when that happens because you've got the roots here, you understand our community.
Oh, for sure. And it's an advantage in a way because I'm from here and I understand this area and the people here, and we go to a lot of the same places to go out to eat or whatever. So it's a neat opportunity to be back home.
Absolutely. As long as people don't come up to you at the dinner table and say, so I'm having this issue. And how does that?
Well, that happens with some regularity, but that's okay. That's just part of it.
Absolutely. So where did you go to school after you left Polk County?
So, as you know, I went to quite a few schools. So when I left here, I went to University of the Cumberlands on a football scholarship. And I played 4 years of college football and had a biology and a chemistry major. And then after undergraduate, I went to medical school at University of South Florida and lived over off Bruce B. Downs in Tampa for 4 years for med school. And then after graduating med school, moved to Columbus, Ohio, where I went to The Ohio State University for my residency, which was a 5-year stint there. And then I continued on there for another year to do fellowship in bariatrics, minimally invasive and robotic surgery at The Ohio State. And then after that was completed, I came back to Florida.
You can tell you're a true football guy when you say The Ohio State University.
Yeah, to me, it was always, being from Florida, I was never an Ohio State football fan, despite living up there for 6 years. So it was always sort of an inside joke with me and the Ohio guys when I would say that. So that's kind of why I threw it out there.
That's good. Well, it looks like you made the right decision and you came home, which is important.
Oh, absolutely. There was no way after living there 6 years that I wasn't coming back to Florida.
So obviously you had the family connection to come back and practice in this community, but is that the only reason you picked to come back to the Winter Haven community to practice?
Well, no, not the only reason. Weather's a huge factor. Outdoor activity is a huge factor with the lakes and the oceans on both sides, the Gulf and then the Atlantic. Spent a lot of time on the salt water and the fresh water and also in the woods. So I grew up doing those things here, and coming back here was something I wanted to do, and then raise my kids in a similar environment doing similar things.
Very good.
Yeah.
So you practice in bariatric medicine. And so tell us a little bit about what is encompassed underneath that field.
So specifically, I'm in bariatric surgery, and bariatrics implies surgery. So I don't do medical weight loss. I feel that and again, I treat primarily morbidly obese patients. So these are patients who have significant comorbidities associated with being overweight. These are examples of this would be diabetes or high blood pressure, other problems as well. So these aren't individuals who need to lose 20 pounds or really could drop the 15 pounds at the holidays. These are individuals who have a metabolic syndrome and have the disease of morbid obesity. And so the most effective way to treat them is with a surgical option. So there are several different surgeries out there to do this. They all have their upsides and downsides. I have settled on the sleeve gastrectomy as its safety profile is excellent, which is my number one concern is patient safety, but also it's very effective as a weight loss operation as well. So at this point, that's what I'm pretty much doing is sleeve gastrectomy.
So when a patient is thinking about weight loss as an option for them, and like you said, this isn't your typical, I got a diet to get rid of the holiday, extra holiday 15.
Right.
What are the first steps a patient should think about when they're contemplating weight loss?
So first of all, are they a candidate? I mean, do they really meet the criteria? And we go by the NIH and the ASMBS, which are kind of directive bodies of various medical specialties and fields. And the recommendations there would be, is my BMI 35 or 35 to 39 if you have diabetes or high blood pressure, or another what we call a comorbid condition. And what that means is a condition that goes along with or is caused specifically by being morbidly obese. So those would be candidates for surgery. Then anyone with a BMI above 40, regardless of whether they have comorbidity or not, they're a candidate due to their weight. Typically, a BMI 40 means that the patient is about 100 pounds overweight. And so that's step one. If you're in that category, suffering from that problem, I think it's important that people who suffer from obesity have tried other options, have tried dieting, have tried physician supervised or used a personal trainer, attempted other ways to lose weight. And in some of those cases, it is successful. But in a lot of cases, it's not. But I think it's important to explore non-surgical options first. Go ahead.
I was going to say, and you mentioned that you specialize in a particular type of surgery.
That's correct.
Can you talk about, you said that it's, from your perspective, it's one of the safest. Can you talk about what that option is in comparison to other options?
So it's an operation we do minimally invasive. So we do it through very small incisions. I guess the most familiar operation to that would be like a gallbladder surgery. This is a more complex operation than a gallbladder surgery, but done in a very similar access. So very small incisions done with the Da Vinci robotic system. And this allows for really excellent visualization and attention to detail that's not allowed through other platforms. And basically it involves removing in a linear or up and down type manner about 75 to 80% of the stomach. And what that leaves behind is a thin, kind of banana shaped stomach. The reason it's called a sleeve is it looks a little bit like a long sleeve shirt if you look at it up and down. And that does two things. It restricts, obviously, the volume of food that can be eaten. But as importantly, by dividing and removing that portion of the stomach, it causes important metabolic changes, such as better control of blood sugar, better regulation of insulin, better regulation of blood pressure, those kind of things. So it works two different ways, both metabolically, like I just talked about, and restrictively. And that's what makes it such an effective operation.
Well, and it sounds like it creates a domino effect in terms of affecting other things within their body and their kind of whole self well-being. So
it does.
After someone has the surgery, can they just go about their life as if they were before, or are there other changes that they have to make the surgery effective more long-term?
Right. And we are looking for a long-term solution here. So we spend on average 3 to 6 months in a preoperative program. This is before they get to surgery, where they're evaluated. They undergo basically teaching and instruction by our dietary department, specifically for what kind of diet they're going to follow postoperatively. Also, they undergo physical therapy evaluations for any limitations that they may have due to, say, arthritis in the knees or hips or difficulty walking because of obesity-related problems. They also undergo evaluation by me. Typically, they'll see a cardiologist. They'll generally see their primary care physician as well. So we want to leave no stone unturned as we get to surgery. We want to make sure that they're prepared to be successful after surgery from a mental standpoint. So they see a psychology group too, because this is a stressful time. So we want to make sure they're prepared to succeed mentally, physically, that it's as safe as it can possibly be, and then emotionally that they're ready to proceed after surgery. So that's just getting up to surgery. And I think it's important for their long-term success that we are so thorough up front. Then after surgery, we have ongoing dietary visits as their diet advances over a period of about eight weeks to a regular diet. And they also see me again on a regular, and they have a support group as well. So all of these things is essentially keep them on the path, keep them on the journey of weight loss, and lead us out through at least the first year, because that's the most critical time, and that's when they will lose the majority of their weight. As far as their diet goes, after the first 8 weeks, it's very special in the first 8 weeks while their sleeve is healing, while their body is healing internally. But after the first 8 weeks, they can eat regular food. It's just that the choices that they make, the nutrition choices are different. The order that they eat in is different. So I always say it's protein first, veggies second, and carbs third, or maybe not at all. And I think that that's an important way to look at it, because there's limited real estate inside of that sleeve. We got to put protein rich foods in there and mineral and vitamin rich foods in there. And that includes your lean proteins and your vegetables. And so that's why we focus on that first. And then afterwards, if there's some carb involved, that's acceptable to you at a limited amount. So what they can eat is dramatically reduced, or the volume that they can eat is dramatically reduced, but the types of foods they can eat, they could go to a restaurant and get grilled salmon and, fresh vegetables and that, but just, it would be a smaller amount, but there's things that they could eat even out.
Well, it sounds like that diet recommendation is something we should all be adhering to anyway.
It's true. It's literally a diet that I try to stick to myself.
Well, we have a lot of restaurant options in the Winter Haven community that people can get a lot of great food options, fresh food options. That made me think of Harborside. I love their salmon at Harborside with their fresh veggies. So
it's excellent. Yes.
Very good options for that. So it's interesting to hear how thorough the kind of pre-surgery evaluation is to make sure that the candidates that are going through this surgery are the best candidates and have the best likelihood of success. What are the risks to going through this surgery?
So there are risks with this surgery. There are inherent risks with any operation. And this is something, because I don't just do bariatrics, I do other operations as well. Many are much larger than a bariatric surgery, much more complicated with higher risk. But bariatric surgery is no different than any other surgery. There are risks associated with it, bleeding, infection, these kind of general risks that we always talk about. Most of these risks are less than 1% or around 1%. So it is a safe operation. It's a fairly straightforward operation, actually. Using the Da Vinci platform, the robotic platform, we're able to do a very meticulous dissection and see exactly what we're doing and control any bleeding that may occur. So even having said that, though, there are still some risks. Now, specific to bariatrics, dietary compliance is the most important thing to reducing your risk. So especially in the first 8 weeks, eating exactly what you're supposed to eat, doing the puree if you're on a puree diet, or if you're on a soft diet. Now, if you've advanced to that, making sure that you're on a soft diet and not eating things that your new anatomy, your new sleeve is not ready for. Mm-hmm. And that can cause complications if that happens. But specifically, it's a very safe operation. One of the reasons I like the sleeve gastrectomy, say, over some other very viable options such as gastric bypass, is that it does have a greater safety profile. And so and I've done hundreds of gastric bypass in the past, but that's the reason I've moved entirely to sleeve, among some other reasons, is because of its safety profile.
So do most patients that are coming to you, have they been evaluated and referred to you by other physicians, whether it be their primary care or their cardiac? How does a patient end up in front of you to be evaluated?
So actually, believe it or not, the majority of the patients that I see, in excess of 50%, are self-referrals. So what that means is they've done research, and the patients who are undergoing bariatric surgery, for the most part, it's a very tech-savvy population. They've done research. They probably know as much about you when they show up as you do. So they know where you went to school, and they know how long you've been doing this. And that's a very common thing. They know if you've done a fellowship, that kind of thing. So the majority of them are self-referral. It's either word of mouth, that they knew somebody who had the operation done, a family member or a friend. They saw something online. They did a search. So a lot of these patients are seeking out a surgical option, and that's how they show up. The other groups of patients are referred, sometimes say by their orthopedic surgeon. This is a pretty common thing, that they need knee replacement done, if not one knee or two, or they need a hip replacement done. But because of their BMI, their weight, the literature in orthopedics says it doesn't support doing replacements on somebody who's, say, 100 pounds overweight because of the complications and the failure rates. So their orthopedic surgeon will say, you go see a weight loss surgeon first, go see Dr. Hall first, undergo your weight loss surgery, get down into the acceptable BMI range, and then we'll talk about doing joint replacement. The same thing occurs for sometimes transplant patients, kidney transplant people who need a kidney transplant, but their BMI is too high for them to be on a transplant list. So I get referrals from nephrologists or transplant doctors who want to try to explore that option first. And then simply endocrinologists who have patients who have terrible diabetes. It's very brittle and difficult to control. Their blood sugars consistently run too high. They will refer patients to for weight loss and better control of their diabetes. So it's a really kind of several different specialists who will refer patients. And it really is a testament to the multi-pronged sort of problems that obesity causes. So I just talked about joint problems, degenerative joint disease, osteoarthritis, orthopedics, then endocrine problems with diabetes and endocrinologists who are sending people to me, primary care doctors through their patients having problem with blood pressure that's uncontrolled because of their weight. And then finally, we've got primary care doctors who are sending them because of things like sleep apnea or other such diseases that are being difficult to get under control because of their weight. All of those types of specialists send patients to me to treat the central problem or disease that's causing the other ones, which is the obesity.
Mm-hmm. So where do you perform your surgeries? Where can a patient expect to go to have surgery?
Right. So I do the operation at Winter Haven Hospital. That's where the program is based out of. Now, I work for Gessler Clinic. They will see me in their evaluations at Gessler Clinic. But the weight loss program, the surgical weight loss program, is based out of Winter Haven Hospital. And the surgeries themselves I perform at Winter Haven Hospital. And the patient does do an overnight stay at the hospital in observation.
So if someone has been contemplating this or has a family member that they think could benefit from this, how can they learn more about this program?
So they can look us up online. Again, the program is new, so we're just getting it set up, but you can go to utransformed.com or the Baycare website, and it will direct you to the Winter Havens program. We're currently building out another website that's going to be kind of a landing space for people to come and learn more about. And there's going to be a bio on there. We're going to have some previous testimonials and stuff. So it'll be a place where they can at least explore some of the information that we can provide. And that way they can have some sort of idea of, is this the proper path for me? Because it really isn't for everybody. I mean, I'm a bariatric surgeon, so I wish everybody who was morbidly obese or suffered from that would come have bariatric surgery, but it's not the right answer for everybody as individuals. And so they need to, people tend to work that out inside of themselves, and then they come to see me for further information, reassurance, and teaching. But most of them have already kind of decided inside that this is, I want to go this route. I want to increase my quality of life. I want to increase my quantity of life. And this is the route for me. So,
yeah, I imagine many people who end up in front of you, their journey has been long in terms of battling this particular disease. So,
it's typically a chronic, lifelong disease.
Well, Dr. Hall, I want to thank you so much for really enlightening us today. I've learned a lot during this interview, just about general health, but obviously about this specific type of surgery. So I want to thank you so much. And as you said, our viewers can learn more by both visiting the Baycare website, Winter Haven Hospital, and then I'm sure you have a profile on GesslerClinic.com as well, so they can learn more about you from there as well. So, well, again, thank you so much, Dr. Hall.
You're welcome. Thank you.